Right, so I'm Melissa and I'm just doing my clinical exam. So I've got me dog here on a towel so that it's lit. Ideally they'll be, restrained, held by another nurse. So firstly we would do a distance exam. Once we've done the distance exam we would listen to the heart. So listening on the bigger side of the stethoscope. On the left side where the elbow meets the body. We want to listen to all the chambers, identifying whether there could be things like the heart murmur. Going down the middle, I'll just show you. Down the middle there. And to the other side. Checking the lungs for any crackling, any fluid in there. We want to use the small side, and we want to listen to the chest on both sides. Sounds good. Once we've done that one, we want to do a tip to tail examination. So starting at the nose, checking for moistness and any excessive discharge that would be clear. So this looks all good. Going down to the teeth. So we want to check the capillary refill time. So putting pressure on that gum, releasing, should be 1 to 2 seconds. Gum colour. Teeth, quick look at the teeth if we can, looking at the tongue, looking down the throat as much as we can, and then heading up towards the eyes, feeling this fur as we go to make sure we do not have any abnormal lumps or bumps. Looking at the eyes, we want them to be bright and clear, no excessive discharge. Both of the pupils looking even. So heading up to the ears. We want to be looking down the ears for any swelling, inflammation. Look good. We want to smell them in case there's a yeast infection in there. They smell good. So feeling underneath the submandibular bular lymph nodes. Can't feel them, that's a good sign. Feeling my way down the neck, heading towards the prescapular, lymph nodes. Can't feel them, that's good. Heading down a little bit to the back, feeling along the spine, feeling the fur for any lumps and bumps. Heading down the front legs, just making sure the limbs are intact, feeling the toes, feeling if there's any grass seed in there, feeling if there's any discomfort. Heading back up the legs, we're going to feel for these axillary lymph nodes at the back. Can't feel them, so that's a good thing. Heading down into the abdomen, I want to keep feeling down that spine. Keep feeling that fur to make sure there's no lumps and bumps popping up. Things in the abdomen we can feel might be a bit of distortion, so it's important that we check that. Give it a wee bit of a pulse, make sure there's no real discomfort there. Heading down to the front of the hind legs, we will find the inguinal lymph nodes. I think that's how you say it. And feel those, can't feel them, so that's a good thing. Heading down the hind legs, again feeling for the limbs, toes, make sure there's no grass seed. Heading back up there, up to the top, feeling down the back, feeling the tail, make sure that's intact. Going down behind, we want to check for the popliteal lymph nodes. Make sure we can't feel them, make sure they're not inflamed. They look good. We want to check the genital area, so if it's a girl, it's going to be at the back. We're going to assume that today. So we want to check to make sure that there's no smell, discharge, inflammation around there, the area. Same with the bum. So it looks pretty good. And the last thing we would do would be taking a temperature for this animal and reporting the temperature for that.